And well, when we talk about the healthcare system, I think you'll agree with me that you need to put the word system in quotes. Because it's, I think you know that all of you involved in it, it's hard to call it a system. I mean, is it really one? Or is it just a collection of related industries? Some large, some small, operating in close proximity of one another. Don't take my word for it. I mean, last week we had this forum that I mentioned already called Smarter Cities, and Dr. Dennis Cortez, as you know, from Mayo. Denny was kind enough to join us, and he gave a wonderful talk. I think he surprised many of the people in the audience. There were about 600 people, governors, mayors, White House officials. I mean, you know, you could shake a stick and the people who were there. Anyway, and, you know, he stood up and made this statement that the room was sort of shocked when he said, he said, the American healthcare system isn't broken. Silence the room. He said, why? Because that would imply that you could actually have a system to fix. And he said, there isn't. We don't have such a system today. And then he was elegant explaining about what a system is versus what the healthcare environment happens to be. And I think you'll agree, that's part of its challenge we have today. And at IBM, you know, this is something we know quite a bit about. We know about systems. Over nearly half a century of work in businesses and governments around the world, we have designed and built, and to some extent we even run, social security systems, modern electronic banking systems, airline reservation systems, retail systems, transportation, food systems, telecommunication systems. I can go on and on and on. Here, India, China, Brazil, third world countries, everywhere in the world, we kind of operate and run these kinds of systems.